Hi everyone. So today I will be presenting an alcohol use disorder, moderate in early remission, also known as F1020 in the DSM-5. This presentation will focus on the symptoms and concerns related to alcohol use disorder, co-occurring disorders, models of addiction, treatment approaches, and recommendations for recovery and long-term support. Alcohol use disorder is a condition where alcohol use begins to negatively affect different areas of a person's life. In a DSM-5, moderate alcohol use disorder means that the person meets around 4 to 5 symptoms. Some common problems include relationship conflict, work, school difficulties, legal issues such as DUIs, and physical or emotional health concerns. The specifier in early remission means that the person has not met the full criteria for the disorder for at least 3 months, but less than a year, except for possible cravings. This shows that the person is actively working towards recovery and maintaining sobriety. Some common symptoms of alcohol use disorder include cravings, difficulty controlling alcohol use, and continuing to drink even after negative consequences occur. Many individuals may try to stop drinking, but they still struggle to maintain control. For example, a person may continue drinking even after legal problems and damaged relationships or any health concerns. Early remission is important because it reflects progress and active participation in recovery. Even though the individual is improving, continued support and treatment are still important. Alcohol use disorder commonly occurs alongside other mental health conditions. Some of the most common co-occurring disorders include depression, anxiety disorders, trauma-related disorders, and other substance use disorders. Alcohol use can sometimes make mental health symptoms worse, and mental health struggles can also increase alcohol use. Individuals may also engage in risky behaviors, such as driving under the influence or impulsive decision making. During early recovery, emotions and mental health symptoms may become more noticeable because the person is no longer using alcohol to cope. Um, One model that can help explain alcohol use disorder is the biopsychosocial model. This model looks at addiction from biological, psychological, and social perspectives. Biological factors may include genetics or brain chemistry. Psychological factors may involve stress, trauma, emotions, or unhealthy coping skills. And social factors may include peer pressure, family environment, and social drinking culture. This model is important because it shows that addiction is complex and usually cannot be explained by only one factor. Treatment should address all of these areas together. For this presentation, the main theoretical approach is motivational interviewing and cognitive behavioral therapy, also known as the CBT. Motivational interviewing focuses on helping clients build their own motivation for change in a supportive and non-judgmental way. The counselor works collaboratively with the client rather than confronting them aggressively. And CBT, cognitive behavioral therapy, helps clients identify unhealthy thought patterns and behaviors connected to alcohol use. Clients learn healthier coping skills, ways to manage triggers, and strategies to prevent relapse. Research supports the effectiveness of both CBT and motivational interviewing in treating alcohol use disorder. CBT has been shown to reduce relapse risk by helping individuals recognize triggers and change unhealthy thinking patterns. Motivational interviewing helps increase treatment engagement and readiness for change, especially for individuals who may feel unsure about recovery. Support groups such as Alcoholics Anonymous can also provide accountability, encouragement, and social support, which are important during recovery. One important treatment recommendation is individual counseling using CBT, cognitive behavioral therapy. This can help clients better understand their thoughts, emotions, and behaviors connected to alcohol use. Another recommendation is relapse prevention planning. This includes identifying triggers, recognizing warning signs, and creating coping strategies for high-risk situations. And a third recommendation would be participation in support groups such as AA, Alcoholics Anonymous, support groups. I think could help individuals feel less alone and provide accountability during recovery. Additional treatment recommendations may include family counseling, especially if relationships have been affected by alcohol use. Family therapy can improve communication, rebuild trust, and increase support for recovery. Healthy lifestyle changes are also important, like exercise, structured routines, stress management, and healthier coping skills can improve emotional and physical well-being. Outpatient counseling may also provide ongoing structure and support while allowing the individual to continue working and managing daily responsibilities. And these are the references I used for this representation, and it also includes the DSM-5 and the motivational interviewing research and resources related to substance use treatment and recovery. Thank you.